Hi, today I am going to try and answer 6 basic questions you may have about schizophrenia. First of all, what is schizophrenia? Schizophrenia is considered a complex mental disorder wherein the person tends to lose touch with reality sometimes. They might be experiencing voices in their head and hearing things almost like hearing anyone else when there's no one else around. This in itself can be quite a scary experience. In addition, people may smell things or see things that aren't there. However, hearing voices is much more common. Also, people can experience something called delusions. These are false fixed beliefs out of keeping with the cultural context of the individual. And for example, the individual may be experiencing fears that somebody is following them, somebody is trying to harm them, or there are devices planted in their brain or in their body that is monitoring them, or they're receiving messages from TV, radio, etc. In addition to all of this, people can experience disorganized thinking. The thought process is quite muddled. And when you really think about it, if somebody is experiencing all of these symptoms quite suddenly, it's a very scary experience for the individual. As a result, the person tends to withdraw, interact less with their family or society, and can struggle by themselves if it is not diagnosed and treated. So the next question is, how common is schizophrenia? According to the World Health Organization, schizophrenia can occur in about 1 in 300 people in the world. It tends to affect about 24 to 25 million people globally. It's not as common as some of the other mental illnesses. However, it is a serious mental illness. And these estimates are thought to be an underreport because a lot of people with schizophrenia don't actually receive a diagnosis or don't receive any treatment. This is something that needs to be changed. The next question is, what causes schizophrenia? The short answer is we don't know. However, we are getting closer to identifying the cause. What we do know is that genetic factors play an important role. We know this from twin studies across the world, particularly in the Scandinavian countries, which have demonstrated that if a sibling or a close family member has the illness, the likelihood of experiencing schizophrenia is much higher. If an identical twin has schizophrenia, the chances of getting the disorder is up there, close to 50%. If a brother or a sister has schizophrenia, it can be as high as 10%. So we do know there's some genetic link going on. Other factors that may contribute to schizophrenia are things such as issues that the person might have experienced when their mother was pregnant. For example, viral infections in pregnancy, or extreme stress levels in the mother, or shortage of oxygen, a condition called hypoxia in the developing brain, are all associated with schizophrenia and in later life. Environmental factors also play a significant part. Toxins whilst the child is growing up, extreme severe trauma in childhood, high cannabis use, especially in younger years, and stress of all sorts can lead to schizophrenia. In general, a combination of factors is what we look at. The next question you might ask is schizophrenia treatable? Yes, schizophrenia can be treated, and majority of the people with schizophrenia can lead normal, good quality of life. If you look at about 100 people who develop the disorder, about 60 to 70% achieve moderate to good recovery, and with support can lead a fulfilling life. About 25 to 35% of people have just one episode of illness and completely recover and never experience symptoms of it again. Some people, unfortunately, might experience relapses of the illness, but with adequate treatment and support can get much, much better and lead normal lives. About 30% of people with schizophrenia, unfortunately, end up in a much more disabling condition, a condition what we call as treatment-resistant schizophrenia, and may require extensive support. Schizophrenia is treated by a combination of medications, psychological treatments, and social interventions. A group of medications called antipsychotic drugs are effective in the treatment of schizophrenia. However, they do come with some side effects, and these have to be monitored quite carefully. Sometimes some people respond well to certain medications and have to stop the medications because of side effects. As a result, receiving care from a qualified health professional becomes paramount. In addition, there are psychological strategies and psychological therapies that are quite effective in supporting and treating an individual with schizophrenia, also requiring assistance and support from the family and the community around the individual plays a huge part in the individual's recovery. What is the outcome or prognosis in those with schizophrenia? About 25 to 30% completely recover, never have any symptoms again, and go on to lead completely normal lives. Another 25 to 30% might have episodes of the illness, but recover when treated and with support, and also have good quality of life, however, might need treatment longer term. And another 1/3 might need extensive support, sometimes in residential care and other hospital institutions. Why is schizophrenia a serious mental disorder? Schizophrenia can cause considerable disability to the individual, to the families, and society overall. Schizophrenia is a condition that usually has its onset or begins in late teenage years and early adolescent years, around the 20s. If you can think about what people around this time are doing in their lives, they're studying, finishing their secondary education, starting off their careers, starting off relationships, and so on. So if somebody is affected in this early formative years of their lives, it tends to have a significant impact on the trajectory their life might take subsequently. Secondly, schizophrenia tends to reduce life expectancy for the individual. In general, people with schizophrenia tend to die 15 to 20 years younger compared to the general population. This high mortality rate is attributed to various causes, including smoking, alcohol and other substance use, general poor health because of the illness, side effects of medications, and so on. This is something that needs to change. Also, another sobering statistic is that there's high rates of suicide in people with schizophrenia. Approximately 1 in 20 people with schizophrenia may end up committing suicide during the course of their life. As a result, it is considered a serious mental illness. Is there any hope for the future? There are exciting treatments happening. Work here in Melbourne is showing that specific treatment identifying iron levels in the brain, certain neuroimaging changes, and identifying markers that can be predictors of good response are all ongoing. Early treatment, early detection, and intervention still remains crucial in improving prognosis. With better understanding of genetics and environmental markers, we do hope that much better treatment options that are tailored to the individual will be available in the near future.